welcome back to my channel. My name is Sharon. If you see me for the first time, I make YouTube videos about medicine and I vlog my medical school journey. So welcome to the channel. And if you're not seeing me for the first time, thank you so much for being here with me, following the journey. I hope you guys are well. I hope you're doing well. So let's address the elephant in the room. There's a hole in my ceiling. This hole in my ceiling, but it's okay. It's okay. I wanted to just make this video and explain to you guys what the heck goes on during clinical rotations. Like, you guys just see me uploading vlogs, see me doing stuff, going places, but you know, just from the DMs that I get from you guys, it seems you guys are just confused, like, what's going on? So that's what this video is. I'll just explain everything to you guys from the beginning all the way to the end. All the way to the end. Okay, so clinicals, what are they? Well, in medicine in Zambia, your first year to 2 years are pre-med, right? So year 1, year 2, you're doing basic sciences, chemistry, biology, physics, and maths, right? Then you have, at my school, you have an interim period where you do something called bridging, where you're taught some of the basic medical sciences, yeah. And then after pre-med, you have your preclinical journey, or as it is called direct entry. So when you're in direct entry, you're in direct entry for 2 years, which is, let me see properly. Okay, you're in direct entry for 2 years, which is where you do your basic medical sciences. You know, the big dogs, the biochem, physiology, pathology, anatomy, all those, you do them. Yeah, that's direct entry. It's 2 years. And then after direct entry, you come to clinicals, which is the last part of this MBCHP journey. That's clinical rotations or attachments, where you have to be at a hospital for 3 years and just basically observe, learn, do procedures. Yeah, so you are there for 3 years. The first year is like our junior, you're called a junior clerk in your first year of clinical rotations, and then your last year of clinical rotations, you're a senior clerk. Now you're in 7th year, everybody expects you to know everything. So one very confusing thing people ask is, what year are you in? Are you in 5th year? Oh, you're in 5th year, so you're finishing this year. Or you're in 7th. Oh, what? At the hospital, they just call us all 5th years, right? They all call us 5th years because it all depends on what your institution was doing for pre-med. If your pre-med was 2 years, that means you're now in 5th year. If your pre-med was 1 year, you're now in 4th year. If your pre-med was 1 year, 6 months, they just call us 5th years. We're 5th years, we're gonna finish in 7th year. Yes, that's it. So that is what clinical rotations is, like how you get into it. Now, what exactly goes on in clinical rotations? Okay, let's talk. So I'm gonna be talking about my school. I have interacted with people from other schools and asked them how they have done things at their school. Yee, my battery is low. Okay, I've interacted with people from other schools, asked them how they do things at their school, and so I'm gonna be kind of giving examples for that, but for the most part, I'm just gonna be talking about my school, which is Unilas. You guys know I got Unilas. So for our first year of clinical rotations, we do pediatric, surgery, and radiology and lab science rotations. So each rotation is 6 weeks. So we spend 6 weeks in the hospital rotating a particular department, right? So when you're in surgery, you rotate surgery for 6 months. When you're in pediatrics, 6 weeks. Yeah, and when you're in pediatrics, you rotate pediatrics for 6 weeks. And then when you're in radiology and lab science, you do that also for 6 weeks. And then we take a break. Other schools don't take breaks. Like Levy, they don't take a break, but we take a break, child. After our end of semester exam, we take a 1 month break, which is like one of the best things about going to Unilas. We take a break. Other people don't take breaks. But yeah, we take a break for 1 month. Then when we come back, we start doing psychiatry rotation, which I heard is like still up for debate. But yeah, we're supposed to do psychiatry because the class ahead of us has done psychiatry, and then we do internal medicine, and then obs and gyn, and then the year is over. Then next year we do year number 2, year 2 of clinical rotations, which is basically 6th year overall. You do medical subspecialty. So surgical subspecialties and internal medicine subspecialties. From the way I understand it, because my school is still new, there's no one from our intake, from our school, who is in 6th year yet. So from what has been explained to me, surgical subspecialties include things like orthopedic surgery. There's also dermatology. I'm not sure if it falls under surgery or medical, but yeah, all those other subspecialties that you can also specialize into, we do it in 6th year. And then in 7th year, you come back and then you have to do the same 5th year rotations again. So you're gonna do obs and gyn, internal medicine, psychiatry, radiology and lab science, and surgery and pediatrics. You're gonna do that again, except this time you'll be a senior clerk. So people expect you to, this time you're like pre-doctor, so you have to know what is up, like what's going on for reals. Because right now in 5th year, we're just confused. I'm gonna be honest, we're just confused all the time. No one really expects much from you when you're in 5th year. You can ask whatever questions you want. The expectation of what you should know are really low, really low. But then when you're in 7th year, they expect so much from you. You have to know the management. I think that's the biggest difference between 5th year and 7th year, is that in 7th year you're supposed to know how to actually manage, like how to actually treat these things, not like knowing the drugs, but actually knowing like when do you admit, and when you admit, are you going to resuscitate? If you are going to resuscitate, what are you going to resuscitate with? If you're not going to resuscitate, are you going to give them any analgesia? If you are going to give them analgesia, what type of analgesia? You're supposed to know which analgesia is contraindicated for which condition. Yeah, now you're a doctor now. You see, these are doctor things. But if we just end on like investigations, and that's it. Like no one really expects you to like know the management. I mean, you should have an idea. If someone has pneumonia, like what are they supposed to get for pneumonia? If someone has sepsis, bacteria, that means we're going with antibiotics. But as far as like understanding, sure, no one expects that from you in 5th year. So that's basically the general outline of clinicals, how it works, year 1, year 2, year 3. Now, what is it actually like being in clinicals? That's a different question now. So when I first started clinicals, I had no idea what I was getting myself into. I didn't have anyone to really ask. I think apart from Precious K, check out her channel, you guys. She also vlogs her medical school journey. I watched some of her videos. I was like, oh, this is what is gonna happen. Okay. But I still had no real way of knowing, anticipating, or preparing for what was coming next. Also, to be honest, my school was very disorganized. Unilas is still very new, so there's a lot of chaos. But this is actually what it was like. Like now I'm telling you guys what it was like, and then in the end I'm gonna tell you what you guys can do to prepare, and all the mistakes that I made that you guys can fix before it ever gets to that point. I'll be your guinea pig, you guys. I'm your guinea pig. I told you, I'm a guinea pig. I'm going to do these things so that you guys know what to do when it's now your turn. Basically, when I first went there, we were doing radiology and lab science, which is a rotation that only my school does. Other schools don't do that. They don't do it. But I am happy that I did radiology and lab science, because it gave me a deeper understanding of the investigative world, medical investigation before you get your diagnosis. Because no matter which doctor you are going to have to order blood tests, you are going to have to order some imaging for your patients. And it was just nice being in that environment, seeing what goes on. And yeah, I think I have much more of a profound respect for radiologists and people in the laboratory world, because from what I heard from these guys, that there's beef between the doctors and the people who were helping with the investigation, because sometimes doctors are unreasonable with the things that they order, or things like that. So now I really respect them way more, because it's a lot of work. Especially if you're working in a big institution like Levy, where there's so many blood tests being done, and you have to do all that. So yeah. And people working in the labs are scientists. They're like actual scientists. They're not just like getting the lab, putting it in the thingy. They're like actual scientists. Like they know what they're doing. Even like with the radiographers, I spent a week rotating ultrasound, and these people could tell things that I was like, Okay. But I'm sorry, guys. Let me explain what exactly happens in radiology. So, in radiology, you have 3 weeks, and then you're divided into groups, and then you are rotating for different departments: the CT department, ultrasound, and what is the other one? X-ray, as well as MRI. MRI is very expensive, so we only managed to see 2 patients, and it's expensive and time consuming, so we didn't really see much. And also, the person who was reading the MRI wasn't even there, so no one could even explain to us what's going on, but that's fine, I guess. And then for CT, oh, there were a lot of cases in CT, a lot. I vlogged my CT rotation, you guys saw. It's a lot of patients coming in, going out, and you see crazy diseases, like crazy conditions, like, whoa, where is your liver, man? I'm sorry, but like the conditions are very serious. That's serious condition. Because if it even gets to a point where you need a CT, it's serious. And then there was X-ray. I'm not gonna lie, I was really bored in X-ray because it's only so many times you can see a pneumonia before it stops being interesting. And then for ultrasound was really fun because it made the most sense to me, in my opinion. Like, you can see, like, okay, this is the uterus, okay, those are the kidneys, that is the bladder, that's the liver up there. Like, you can see, you can visualize. So yeah, that's what happened for us. So it was 3 weeks. We divided the time. Ultrasound was a week, CT was 3 days, MRI was 2 days, and X-ray was also a week. Yeah. And then afterwards we did lab science. Yeah, we were also divided into different groups. There's the hematological groups, there's the chemical part. Yeah, there's all these different, there's blood bank. Okay, let me see if I can remember. There's molecular, right? Molecular, I'm gonna say chemistry, I don't know. We only spend a day there. That's where they do like the HIV tests and stuff. There's hematology, where they do like the syphilis tests, the malaria tests. And there's the chemical part. In chemical, they do a lot of the liver function tests and things like that. And then for blood bank, that's where you do your cross match to see if the different blood you want to do for transfusion are gonna cause a reaction to see if the person's blood is compatible, the ABO and RH reactions. All of that is done in the blood bank department. So we rotated through all of that. We'd spend a couple of days at each rotation, just watching, seeing, learning. Yes, all of that. And then that was the radiology and lab rotation. And then afterwards we had, for my group, we went to surgery next, as you guys saw. I love surgery so much. I am pretty sure I might choose surgery as my specialty, but it's still so early. But I love surgery so much. First of all, I loved the rush of surgery. There's always something to do, always, every single day there was something to do. You have to think on your feet a lot, and you see the most interesting conditions. I'm not talking about ulcers and wounds and burns. I'm talking about like the RTAs. The RTAs, oh my god, being a medical student, I'm smiling at the idea of an RTA. Anyone else would be like mortified, but it was fun. It was really fun. So in surgery, we were divided into groups again, and then surgery was so organized. It was the most organized of all the rotations, like so organized. So when you're on call, you spend a whole 24 hours in the hospital, and you work the department you're supposed to work. If you're in surgery, you're gonna be in casualty or AML, and then you have to be there for 24 hours. Now, as a student, no one really expects you to do all that. It depends on your firm. But for my firm, they're really understanding. So you can work up to like 20, 21. If you have the transport to go home and it's safe, you can go home. If you want to stay, like how we used to stay, me and my homie talk, or you guys watch that, like we used to stay, wanted to see things, okay? We wanted to see. The student, for the most part, they're going to be nice to you. Now, where do you sleep when you're on call? There's a lot of places where you can find duty rooms in the hospital, and because we got to do radiology rotation, we knew where all the radiology duty rooms were that nobody else knew. So we're able to find places to sleep. So yeah, that's what happens when you're on call. And then afterwards, you have your post-call day. You don't go to the hospital when you're post-call. You go home. So like I said, you're coming in the hospital at 8, 24 hours in the hospital. Then afterwards, that day from 8 a.m., for example, we're on call on Monday. So on Tuesday from 8 a.m., you're free. You go home, you rest, you chill, sleep. On Wednesday, we used to have clinics. Yeah, Wednesday was clinics. So all the patients that have been reviewed to come back later, they come on Wednesday, and then you review them in the clinic department. Yeah. And then on Thursday, that's actual theater, actual surgery. Now, obviously, if you're an actual surgeon, you're working every single day. Every day is a surgery for you. But when you're lower down in the ranks, you only get to see theaters on Thursdays. And you guys, I'm actually gonna make a detailed video for surgery, because I can see like this is gonna be a whole thing. So I'll make a detailed video about surgery after this. So if I'm wearing the same outfit, don't ask me questions, because I'm re-recording on the same day. But yeah, so after theater, it's Friday, and that's just the general ward round. All the patients that have been admitted, you go check them out. Yeah, so that's what happens in surgery. Yeah. And then for peds, that was a mess. Peds was so disorganized. I don't even know if I like pediatrics or not. Maybe I actually do like pediatrics. So I was saying there was extreme disorder in peds, absolutely extreme, like truly shocking levels of extreme disorder. And maybe I would have liked peds. Maybe I would have liked it. But because of the terrible organization, I was just like, this is not for me, child. But anyways, basically what happens in peds is you're supposed to clerk patients, except this time you're not doing it like firsthand, like you're not the one writing in the file, but you just clerk for 45 minutes. You ask the patient everything from like their history of presenting complaint. You ask for the birth history, immunization history, drug history, all of that, and then you come up with the differential diagnosis, and then you have to examine that patient, and then afterwards you present it. Afterwards you come up with a second differential diagnosis. You write down your investigations that you're gonna take. Management, not really in our level, but if you're overzealous, then sure. And then you go find a doctor. Beg a doctor. You have to beg a doctor to present to them. And that's another thing, like, why am I begging to present? Like, why am I begging to learn? Like, what is the order here? Why do I have to beg to learn? I think there's one time where we clerked a patient and we had to wait like 4 hours before we could present it to a doctor. 4 hours. I don't care how interested you are in peds. If you have to wait 4 hours, you're just sitting down for 4 hours to present something, your enthusiasm goes away really quick. So yeah, but overall in peds, we just saw a lot of babies in NICU, and then we saw a lot of children downstairs who had the most common conditions, you know, the malaria, meningitis, and all of that. Yeah, so that's what happens in pediatrics. You go there. We were separated into 2 departments. There's the NICU department upstairs, and then the general peds department downstairs. NICU is 3 weeks. We're supposed to be up there, 3 weeks downstairs. In NICU, I did like that there was some order. You know, the lady was teaching us, doctor, I don't want to say her name. I don't want to say any doctor's names in this channel, because yo guys, imagine I get sued. I don't have a single coin to my name, not even one. Then I get sued. Anyways, one of the doctors, she was lovely, very smart woman, and she would teach us really well. She'd take her time teaching us, like macrosomia. She would sit, she'd teach us the risk factors, the complications, you know, everything that you would want to learn about macrosomia. She would teach us that, and then the next day, and she would teach according to your clerking, so you have to clerk that patient. And then for downstairs, chaos, disorder, I mean, chaos. I don't even. I'm not even gonna make a video about peds, because I don't think I even have anything much to say, because I'm still confused. It's finished, but I'm still confused. But basically, let me start from Friday. Friday was sickle cell clinic, and then Thursday was general clinic. Wednesday was art clinic, which is HIV clinic, and then Tuesday was the major ward round. Monday, nothing really happened. So, for example, for the major ward round, you go in the morning. Some of the doctors teach if they want. Somebody teaches at some point, but the general ward round is only an hour, maximum 2 hours. And after that, there's not much else to do. So you stay, you clerk patients, you beg somebody to present to them if you want, if you have that energy. But because also of the disorganization, which I will say a million times, there was disorder, there was chaos. Because of that, a lot of people didn't really feel that enthusiasm to stay behind and clerk patients, which overall, like, I'm pretty sure those people are gonna clear, those people are gonna pass. I was part of one of those people sometimes. I'm not gonna lie to you guys here, but because of it, at the end of the day, that's how pediatric rotation is gone. It's gone. So now we're just expected to know these things. So that's peds. Actually, guys, if you're going to a different hospital, maybe peds is a much more pleasant experience, and I've just taken away some enthusiasm from you. Don't feel demotivated. It's just at this hospital. Maybe even now it's better. Maybe they've even fixed it. So yeah, I am bad mouthing an entire department. Maybe they fixed it. But for me, peds, honestly, I'm not gonna be a pediatrician. I don't want to see babies sick. I don't enjoy it. I don't like looking at babies who are in pain. It's not something for me. Also, the conditions in peds is like mini internal medicine. Like, kids can have every disease, every single one, and you have to know those diseases. Also, another thing that contributed to this disorder was the fact that for exams, we didn't have a guide on what to study. We just had to know everything, which, imagine, enough. I can complain for hours. And then, so that's surgery, that's peds, that's radiology and lab science. That's what I've experienced so far. And now we're going on break with our exam. OSCEs. Let's talk about OSCEs. So OSCEs are like the practical for these courses. So for example, for pediatric OSCE, you are now asked about the cases. So they will bring up a picture or a video of a child in the department, and then you have to answer. They'll ask you what are the complications, what are the risk factors, indications, all of that. You have to know. You just have to know that stuff. It's like, yeah, for me, peds OSCE was not that rough because it just wasn't. And also because in NICU, I had such a good background in NICU from doctor whose name I'll not say because I don't want to be sued. But even though I'm saying nice things about her, she wants to me. Let me not do it. Anyway, she did a good job of teaching us and laying down the background. So for me, for OSCE peds, it was not that difficult. Peds theory. Whew. That was something else now. Okay, that was something else. That was wild. That was the wild west. That was hard. That was really hard. That was extremely difficult. That was difficult from the beginning to the end. Primarily because of the confusion. The peds diseases are not harder than any other disease. They're just this disorderly chaos. It's chaos. So yeah, what I'll say is, until they fix that and you're gonna do your pediatric rotations at Levy, buckle up, okay? You're going for a wild ride. Buckle up. So yeah. That's that. And then for surgery OSCE, same thing. Yeah. Surgery OSCE was rough. Okay, you know what? I will complain about surgery OSCE in a different video. Anyways, so the mistakes that I made, things that I could have fixed. Yeah. So one of the mistakes I made, one of the biggest mistakes, was not studying in December. I was on break in December, and honestly, I was just tired. I just wanted to rest. I was at home being a couch potato, eating everything in the fridge. And I regret that a lot because I could have studied during that time. I should have studied. If you are going for clinical rotation, study, my friend, okay? Study, because as far as they're concerned, you're done with basic science. You know everything. Every single disease in basic science, they think you know it. So when they start asking you all these questions, sickle cell management, all of that, like, they expect that you already know the pathophysiology of things. So just brush up on that. Read, okay? Another mistake that I made is I used to be scared to ask questions. Yeah, like when I first came, I was like, I had so many questions, but I'd be scared to ask because I felt like I'm inconveniencing the doctors. But the reality is the doctors are working at a teaching hospital. It's in the name. Levi Monawasa Teaching Hospital. What does that mean? It means their job is to teach you. I don't care how annoying you have to be, learn, know it. Because when you finally get to 7th year, no one is going to ask you like, oh, did you have this doctor? Oh, you were scared to ask. That's why you don't know. Nah, they're going to say that. They're going to expect that you already know everything that is going on like already. So yeah, you do have to know you do have to know that. So you do have to know that. So yeah, like feel free to ask questions. Questions are good, you guys. Questions are how you become better. Questions are how you learn. So I regret not asking as many questions as I should have. Yes. And then things that you can do to prepare, how to prepare for clinical rotations. I don't know why I just did a pop and lock. I'm sorry. Things you can do to prepare for clinical rotations. Number one, studying, obviously, making sure you're on top of your game. And then also, like, eat. Eat. Bring water. Eat. You're going to be standing. You're going to be on your feet. You're going to need to make sure you're taking care of your body. So make sure you're eating. Make sure you're packing lunches. Or if you're going to be eating from the hospital, making sure you're bringing enough money for lunch. Because, guys, you'll be standing for a long time, okay? And then another thing I would say is be involved in every aspect of the process. Ask as many questions as you can. Every condition, no matter whether you think it's silly or what, like be extremely involved in every aspect. Like everything you ask, you learn now. You know, I think studying for exams is kind of over. You're no longer studying for exams. You're now studying for real life. So every condition you see, you might see it again. Maybe we won't learn about it in class, but you see it in your practice in the rural areas. There you'll be alone without a city, without a so yes, you guys, I think that's all I have to say for now about clinical rotations. Interesting journey. I have 5 semesters left. And I'm sure I'm gonna learn so much in those semesters. I'm gonna make sure to share my knowledge with you guys, whatever I learn. And ding 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 ding. Yeah, so that is the video. If you made it this far, definitely like, comment, subscribe, and share this video with people you think might be interested in this video. And until next time, you guys, thank you so much for getting to the end of this video. I'm off to film the surgery video, and then I'm gonna decide if I'm gonna film the peds video, because I feel like if I start filming for peds, I'll just be complaining the whole time. I'll just be ranting, and nobody needs that, child. But I'm gonna film the surgery video now. So bye, guys. Deuces.